it is important to know how a mental illness is identified. It's important for everybody, to our friends, to relatives, and to members in the society. It becomes quite easy to identify the symptoms when you know the person or you have been living with that person. That means if they are our family members. But if we come across a new person, unless the symptoms are very severe, it's very difficult to identify and pinpoint. So there are some situations in life which are high risk. Let's call these symptoms as transitional state. That means when certain things are changing or transforming in our life, the transition occurring in age, when someone is going from adolescence to adulthood or from late adulthood to older age, the chances of developing mental disorders are much more. And therefore we find the rate of depression, anxiety, and even suicide behavior very significant in these subgroups. Similarly, there are social situations, for example, migration from one country to another or from rural areas to urban areas, retirement. Similarly, in certain social situations, for example, migration from rural to urban areas or from one country to another, or retirement, economic loss, divorce, marriage, relationship. So these are the situations in which chances of developing mental disorders become significantly high. It becomes much more severe if a person is genetically predisposed to have mental disorder. That means if anyone in the family, if anyone in the family has been suffering from mental disorder and the individual has high genetic loading, the chances of developing mental disorder becomes much more in presence of these psychological and social stress. And therefore one need to keep an eye about changing situations in life, to be more careful and try to identify the symptoms in our emotion, memory, thought, and behavior. Once these symptoms are identified, it is important to help the person. Sometimes individuals can help themselves. It is not necessary that everybody should seek a psychiatrist's help or the help of mental health professionals. In a number of situations, a family physician or a doctor is a good person and competent person to deal with the situation.